Hi, I'm Frank Marrero. I'm a gastroenterologist at Lake Charles Memorial Hospital. I've been here for about 16 years. As a gastroenterologist, I take care of a wide variety of gastrointestinal diseases.
My name's Dr. Darin Doumite. I'm a general surgeon at Lake Charles Memorial Hospital. The bulk of my practice is colorectal cancer and diverticular disease.
Colorectal cancer is one of the most common cancers and is one of the most deadly cancers in the United States and worldwide. And it is mostly preventable, and you can do that with screening tests. People often avoid screening because they say that, well, I don't have any symptoms. And I can tell you the most common symptom of someone with colorectal cancer, especially early stages, is no symptoms at all. So that's why it's really important to get screened.
At Memorial, we have a great dynamic team of GI physicians, surgeons, and what we is called the tumor board, which is made up, all in all, probably 15, 20 physicians that meet weekly. Any diagnosed cancer case at Lake Charles Memorial Hospital is presented at this tumor board meeting. I think it's very important that we're all on the same page, and we have what comes out of that meeting is a packet available to the physicians, including primary care, surgeons, the oncologist. We all kind of know how to move forward with the patient and their treatment plan, and it's very laid out, and the patients are given a copy and they understand their treatment moving forward and expectations.
Colonoscopy is a test that people love to hate. In actuality, most patients, when they're finished with it, realize that it wasn't nearly as bad as they thought it would be. But about half the time we find polyps in people's colons, and polyps is exactly what we're looking for as gastroenterologists, because most cancer screening tests are intended to find cancer. Colonoscopy is really intended to prevent cancer, and that's why this is a preventable disease. If you come in and get screened, we can remove polyps and prevent you from getting colon cancer.
Receiving cancer care locally at Lake Charles Memorial Hospital is very important moving forward for patients, for coordination of care, having a local physician, and just access to local care. There is a lot of value in staying local. Patients have access daily to us. They have our phone number. They can pop in clinic anytime, and us having access to the oncologist who are one floor above us, having access to the radiation doctor. We meet with them at lunch every day. It's a different kind of care, and I think the patients that have stayed, which is greater than 95%, appreciate that, and they would echo the care here is superior to going anywhere.
Here at Memorial, we have our unit is recognized nationally for our quality, and that is unlike any other place you could have a colonoscopy anywhere in this region.
We're ranked #1 or #2 in the state in robotic volume at this facility, and I think that goes a long way in saying we've been doing robotics for 4 years here, and we're already ranked in the top 1% in the whole state in the number of colectomies we do with our robotic volume.
Providing care to patients in the community, and that's something that we take a great deal of pride in. This is where we live. These are our friends and neighbors. These are our teachers, educators, our policemen, everybody that lives around us. We want to make sure that they're healthy and have very long and productive lives. We do a very good job at taking care of these patients, no matter whether they present for screening, if we find that they already have a cancer. There's a lot of hope out there. Treatments are getting better, and we have an excellent medical team here to take care of all those people, from the oncologists, the surgeons, the gastroenterologists.